If you feel a nagging ache or sharp pain on the inner side of your elbow when you grip, lift, or twist your wrist, you might have golfer's elbow. The medical name is medial epicondylitis, and just like its cousin tennis elbow, most people who get it have never swung a golf club. It is an overuse problem that shows up in anyone who grips and lifts a lot, from manual workers to gym goers to people at a keyboard. The discomfort can be stubborn, but the good news is that it usually improves with the right care. In this video I will explain what is happening inside your elbow, why it hurts. To understand golfer's elbow, picture the muscles on the palm side of your forearm, the ones that curl your wrist and fingers downward and rotate your forearm. These muscles funnel into a tough tendon that anchors onto a small bony bump on the inner side of your elbow, called the medial epicondyle. Every time you grip, lift, or flex your wrist, that tendon takes the load. When those motions are repeated too often, too hard, or without enough recovery, tiny tears build up faster than the tendon can heal. Over time the tissue becomes disorganized and weakened, which is why this is now understood as a tendon breakdown rather than simple inflammation. That is the classic sign is pain and tenderness right over that inner bony bump, sometimes spreading down the inner forearm. It typically flares with gripping, lifting, twisting a doorknob, or bending your wrist against resistance, and some people notice a weaker grip. The pain usually builds gradually over weeks rather than from a single injury. In most cases a clinician can diagnose golfer's elbow from your history and a focused exam, often by pressing on the tender spot and asking you to flex your wrist against gentle resistance. One thing to watch for is that the ulnar nerve, the funny bone nerve, runs nearby, so doctors check whether numbness or tingling spreads into the ring and little fingers. Here's the reassuring part. The large majority of golfers' elbow cases get better without surgery. The first goal is to calm things down by easing off the activities that trigger the pain. Not stopping everything, but modifying how you grip, lift, and twist. Many people get relief from a forearm counterforce brace worn just below the elbow, which offloads the irritated tendon, and checking your technique in sports or at work can prevent it from coming back. Ice after activity and short-term over-the-counter pain relievers may help with flare-ups, though it is sensible to check with a pharmacist or doctor about what suits you. Patience matters, because tendons heal slowly and this often takes weeks to months to Once the sharp pain settles, gentle strengthening is often the key to lasting recovery, because a stronger tendon handles load better. One well-studied approach is slow, controlled wrist exercises that emphasize the lowering phase of the movement, sometimes called eccentric loading. A simple version is to rest your forearm on a table with your palm facing up. Hold a light weight, slowly lower your wrist, then use your other hand to help curl it back up. Gentle stretching of the forearm flexors, by straightening the elbow and easing the wrist and fingers back, can improve flexibility. The rule of thumb is that mild discomfort is okay, but sharp or worsening pain, or any tingling into the fingers, means back off. So when should you stop self-managing and get evaluated? See a clinician if the pain follows a sudden injury. If you notice numbness, tingling, or weakness spreading into your hand or into the ring and little fingers. If the elbow looks swollen, red, or hot, or if you have fever along with it. Also seek care if the pain is severe, keeps waking you at night, or simply is not improving after several weeks of sensible self-care. These can signal nerve involvement or something other than ordinary golfer's elbow that deserves a closer look. To recap, golfer's elbow is an overuse problem at the inner elbow tendon. It is common even in non-golfers, and most cases improve with activity modification, a brace, and gradual strength.